All right, here's your Jeopardy answer of the day. This disease is the number one cause of disability in adults under 50. The answer is migraine. It's kind of surprising that it's that powerful and it has that much control over people, but migraine sufferers really don't like to talk about it. They like to keep it to themselves. To make a diagnosis of migraine, the patient has a mild to moderate headache, and then one of these two things. It's one-sided, or throbs are made worse when they bend over. And then the other one of these next two things, they're sensitive to light and sound, or they're nauseous. So if you've got someone that says, I've got a really bad headache, it throbs, and I have to wear sunglasses, that's migraine. I have a really bad headache, it's on one side, and I get nauseous. That's migraine. So migraine is made on a symptomatic presentation. Over 99% of the time, if the patient has those answers to those questions, there's nothing else wrong with them. The CAT scan, the MRI, the blood work, it's all negative. So the problem with migraine is they really have nothing to show for what is really bothering them. In fact, most migraine patients want to get an MRI because they want it to be a tumor. They want it to be something that they can hang their hat on because no one believes them. It's very difficult for them, for example, when they go to the ER and they've got a bad migraine and they used to get a shot of Demerol. Well, there's no way to tell if they're truly having a migraine or not. And so the ER doc sometimes becomes suspicious. It's very difficult on a migraine patient. It's also important to add that when you're making a diagnosis of migraine, that when the patient is reporting this headache to you, that it's not the worst headache, migraine pain they've ever had, or it's not the very first one they've ever had.